important activities, and I'm honestly very thankful to UNICEF and the team for actually conducting this activity. We started this with looking into Maldives, and actually I'm just going to take off the mask. I assume everyone has received their booster doses. So yeah, we began this activity by looking at Maldives as a whole. Like, why is the health system of the Maldives functioning the way it is? Why are there so many discrepancies, and why is the vaccination rates falling in the Maldives? Like, all of these things, we started looking into it at the entire health sector. And what we realized is that Maldives actually had a really wonderful primary healthcare system established initially that was actually aided by WHO. But then, slowly, the system started changing with people migrating to Maldives from the islands, which actually started a chain reaction that resulted in raising of socioeconomic issues, changes to lifestyles, shift in a food and exercise culture. I'm being very brief here, and also rising in non-communicable diseases. As you know, most of our mortalities are actually through non-communicable diseases. People, as soon as we started receiving education, as soon as our socioeconomic statuses started going up, people started going abroad, started looking at tertiary hospitals in places like Singapore, Malaysia, and wanted that same sort of same amount of facilities in Mali or in the islands where they lived, which resulted in people starting to self-diagnose themselves, wanting specialist services, and people stopped wanting to engage with the health system on a primary healthcare level and wanted to engage with the health system on a specialist level, which caused a lot of overburdening when it comes to specialists. Also, we started noticing that there is a significant lack of health information amongst the population. Like, for example, people stopped attending family planning sessions, people stopped understanding like what was causing strokes or heart conditions and respiratory diseases. Not many people are really interested in receiving all this sort of information, and what we started noticing was even within the health system, people were struggling to pass on that information to people. Why was that happening? So that's what we actually started looking into. Why was the primary healthcare system in the Maldives deteriorating? So what we noticed is it was actually a policy shift. So it even at the policy level, the government actually stopped investing in primary healthcare because the primary healthcare system was already so established. People at the policy level wanted to invest in tertiary care. So yeah, moving forward, let's move on. Next slide. Yeah, so as a result, the expenditure that on a policy level, people started spending more on establishing curative care level, tertiary level facilities, on infrastructure. So as you notice, primary healthcare, or the expenditure that actually goes towards public health, started going down as the years went forward, whereas curative care, or the investments that was made to tertiary level facilities or establishing infrastructure, health infrastructure, machineries, the medication, consumables, that went upwards. Can we go back to the previous slide? Previous. Yeah, that one. So despite us spending so much on curative care, people still went abroad. So as you can see, this is the number of people who are actually seeking treatment overseas. The one in green, on the amount of medication, or is the amount that the government was spending on pharmacies, because the pharmacies were dispensing so much medication. So if the tertiary care facilities, or as people wanted, if people were receiving such wonderful specialist care in the Maldives, why were people still seeking treatment overseas? And why are people receiving so much medication in the Maldives? So those are discrepancies that we actually needed to look into. So the current status of the Maldives is we care little about the public health or primary health care, but we care so much about the curative care side of things. So specialist care, people wanted, as you may notice, the government actually spends about 9.41% of our GDP on health, and despite all of that, people still went overseas, people still spent a lot on medications, people still spent a lot on receiving specialist care, but still, the multiple and non-communicable diseases level was going up, the level of vaccinations is going down, lack of health information is there, people are not exactly very much aware of their health and well-being. So we're not exactly doing an amazing job if you actually think about it. So a paradigm shift needs to come about. So what we propose is actually giving a same amount of importance to public health and primary health care as much as we are giving to curative care. Primary health care actually falls in between curative care and public health. Primary health care is the first point of contact when it comes to the health system or even health and well-being of people. So that is the place where we actually need to be focusing on. Otherwise, like our health systems are just going to be overburdened. And as Dr. Shah mentioned, in Cuba, even 70% of all the diseases and health and well-being is actually taken care of within the community, and only 30% of the illnesses are sent towards the tertiary care facilities. So our objectives was the successful delivery of the Health Ministry mandate, which is to ensure the health and well-being of people, properly regulate the health services, guaranteeing quality of health services to the people, and also utilizing the health resources, all the resources that we have. We are not utilizing our health resources properly, so we need to start doing that. We also need to recognize the areas of the resources that we need to develop within the health system and within the health and well-being or social systems in place. We need to provide education and job opportunities to people within the health systems in order to provide the services that people require. We need to decentralize the health services because, as you know, in the Maldives we have around 186 inhabited islands, and we need to properly decentralize health services so that all of these islands receive a proper amount of health care. We also need to digitalize our health information services, which is actually crucial in a country like the Maldives. Let's move on. Yeah, move on. Because this is not exactly very crucial. So, primary health care. Primary health care is treating all common medical conditions and allowing medical professionals to refer patients to the hospitals and other medical services for urgent and specialist treatment. Primary health care focuses on the health of the whole person, combining physical, psychological, and social aspects of care. So it's a whole lot of things in one thing. So the three pillars of primary health care is multi-sectoral policy and action, empowerment of people, and primary care and essential public health functions of integrated health services. We need to actually focus on the multi-sectoral policy and action part of things and empowerment of people and communities, and also we need to integrate the health services. As Dr. Shah mentioned, we visited Cuba just recently, and something that they actually focused on, they told us, is intersectoral collaborations. All of the sectors that actually provide are crucial to ensuring the health and well-being of people need to start working together, need to start collaborating on a more significant level. Our sectors actually need to understand that they cannot function separately, that they need to function together in order to ensure health and well-being of the community. So that is actually crucial, and we need to empower people with all the information and actually work together. All the sectors need to work together to empower the people. So the 5 key concepts that we actually need to attend to is providing first contact of care for new health problems, comprehensive care, like this is really important, comprehensive care for most health problems, continuity of care. So care needs to continue, and I'm honestly preaching towards people who actually know this. I know that you guys know this. And also long-term person-focused care and care coordination and disease prevention. So these are the 5 key concepts that we need to focus on. Yeah, let's move on. So the team that we are proposing and the team that actually our belief in this team has actually significantly improved given our Cuba trip as well. But in order to provide health care on a community level, we need to start working together. So as health ministry, we need to develop a team with a community health worker, nurses, and doctors. And all of this team needs to work on an integrated basis. What we're noticing is public health units and the clinical care units work quite separately. They don't work as an integrated team, but they need to start working together and actually coordinating with each other to provide primary health care. Each and every single one of these people has an important mandate, and they need to work together in order to actually deliver it. But there is also a team that exists outside of the health centers that need to collaborate with this team, which includes the councils, the social services, the youth, the education, and I'm quite glad the education ministry is here because they play one of the most important roles in actually ensuring the health and well-being of the community. So information pathways need to exist on both ends, and information needs to be shared between all of these people within this team in order to ensure the health and well-being of the community. Because all of these people, the councils, they talk to so many people, the social services, education, the youth, focal points, they will be in touch with different levels and different age groups of the community on different forums. So that is the team that we are actually proposing. So within the situational analysis, the assessment that we did, we understood that there was a lacking digital platform. We are missing central patient records. Though the hospitals and the health centers do have central patient records, it's not exactly being shared amongst the 186 health facilities, but that needs to be actually shared. The information needs to be shared accordingly on an integrated pathway. We are lacking SOPs and guidelines. Our human resources are lacking training. In fact, when we actually visit islands, they actually note that point as well. They note that they are not exactly receiving trainings. Before, in the past, they used to receive trainings on a quite regular basis, and they actually noted the lacking of training that they receive right now. We are missing qualified HR as well. We are lacking knowledge in the Maldives. There are salary discrepancies, unfortunately. They don't audit themselves, which means they don't actually work to improve themselves. And we are actually lacking proper infrastructure, and also we are lacking equipment in some health facilities as well. So we, as a team within Ministry of Health, we identified certain populations where we can actually pilot some programs. And we went for islands with 1,000 and less populations, because those are the islands that are actually neglected within the health facilities, within the health system. We identified 76 of those islands, divided it into 3 phases, and we've currently conducted some training programs for 2/3 of the islands. We are going to begin digitalization. At the moment, Ministry of Health is actually working on that program. We are doing competency assessments at the moment, establishing SOPs. In fact, the UNICEF team is actually working on it as well, and WHO is working on helping us with the SOPs and the guidelines as well. We would like to initiate the training programs through Maldives National University because they are accredited training facilities. And we would, at the end of this exercise, we want to establish an evidence-based health system where we actually work on evidence and actually intend to establish health services based on people's health requirements of the people, not just by political will, because it doesn't work when we work that way. And at the end of the day, we want to guarantee patient safety and satisfaction. That is what we are actually working towards. So if by actually conducting this exercise that Dr. Sheena and them and their team have conducted, we are hoping to establish an evidence-based healthcare system and actually identify the areas where we actually need to focus on posting and on improving. So I'd like to pass on the mic to Dr. Sheena to actually, yeah, I'm actually quite done. But